Hey everyone, imagine one day going to your doctor and they're actually prescribing some sort of psychedelic medicine. But before we get to that point, how do we get to a point where people are going to trust the process? What is it going to take? In our latest podcast, the CEO outlines what exactly we need to do over time to make sure people feel trusted about this alternative medicine. Here's the latest. Hey everyone, welcome to the Dales Report podcast, and happy to be joined here this morning. The CEO of Mydecine, Josh Bartch, joins us. Happy New Year. End of January already, but how have you been?
I have been well. Happy New Year to yourself as well. Good to be back with you.
How's life down in Puerto Rico?
I mean, it's beautiful. Absolutely. I mean, the weather is fantastic. It's nice. There's been cold storms, I think, pretty much every state in the continental United States. So it's been nice to avoid that. So no complaints.
Yeah, well, good for you. I do want to ask, before we get into a lot of the details and work that you guys have been focusing on, what's your make? You know, we see a lot of big time announcements within the industry as far as advancements overall for the overall health of the industry, especially with Health Canada and their amendments to the new special access program. Yet biotech and more specifically psychedelic stocks continue to hit hard. But what's your advice, or what's the communication you're telling to your investor base about where you are right now, but long term where you potentially are going to be?
Yeah, I mean, I think that, kind of what you finished that sentence with, the term long term is really important, right? I think that you're seeing this kind of shift in, and it's been happening, a transition has been happening for quite some time, where you had the initial investor that kind of got into psychedelics without really fundamentally understanding what it takes to operate a biotechnology company and really do end-to-end drug development. It's a long process. And they kind of had that short-term cannabis mentality. And I think that you're starting to see a lot of those shorter-term investors kind of take an exit. A lot of them already have. And then, the new, more sophisticated biotech investor that really understands fundamentally, one, the upside of this industry as a whole, and two, that it's a long process, right? And nothing's going to happen overnight. There's no instant gratification. Obviously, you see interim data coming out, and you see advancements. But the real kind of glory days are definitely ahead of us, and something that we're working hard to get to. So,
that's promising.
I think patience is incredibly important, and you got to weather the storm, the ups and the downs, the ebbs and the flows. They're inevitable, but it's something that it's all a part of the equation.
Josh, you're connected to Wall Street. What's some of the, feedback or conversations you're hearing from institutions on their overall outlook of this industry?
Yeah, I think you kind of have two, right? Some of the smaller, more bullish funds are definitely, actively engaging. They're consolidating positions. They're kind of looking at, where are the bargain buys, right? Because there's a ton of what I would consider bargain buys. Not just us, but really kind of across the map, right? You're seeing the vast majority of the psychedelic industry at 52-week lows, and they're setting new 52-week lows daily, unfortunately, which I think is kind of, it's unjustified for sure, right? It's an overreaction, and it's something that there's been a compilation of kind of outside market events that have negatively affected a number of industries, and unfortunately, we're feeling that as well. I do believe that, when you see a rebound, it's going to be sharp. And it's going to be swift, and I don't think it's that far away. It's something that is in the.
You don't think it's far away?
I don't think so. I think that we end of Q1 there'll probably be some rebounds. Hopefully there's some better numbers posted. There'll be additional data coming out. You see additional advancement, and then hopefully some catalysts as well in the market that kind of regains investor sentiment. I think through all of this, what's really, really important for companies, one, they need to pivot. Two, they need to look at, where are they spending money? What's their balance sheet?
Yeah.
We've done that exercise and kind of looked at how can we trim down our monthly burn rate? How can we really make sure that where we're putting out money is really useful and purposeful and strategic as well. And, I think that the multiple companies need to do that as well, because
of course
you had this free-for-all money really flowing, and now, money's harder to get, et cetera. So needless to say, I think it's good. And then also from kind of the investor side, I think it's a good time, and it's really important for us as companies, the industry as a whole, to really educate the general investment community on a number of factors in the industry. One, again, patience, timing, the process of drug development. But two, it needs to be put in context about things like Compass's 2B results that came out that was incredibly positive, but I don't think that they were properly portrayed to the general investment community, right? They needed context around treatment-resistant depression. That's an incredibly hard, almost impossible indication to treat. So when you're seeing 24, 25%, those are astronomically large numbers that you don't see in any other treatment modality at all. But because they were benchmarked against MAPS's readouts, which off the charts, but two different, completely different indications, different constituents. One incredibly hard to treat. One was, kind of cherry picked a little bit, and I'm not so sure that it's a direct representation of what you would have seen in a treatment-resistant PTSD population like veterans, et cetera. So, I think that there needs to be an educational piece, a consistent message across the industry, and something that we need to kind of come together to work on that. And if that's done properly, I think that you'll start to see investor sentiment really start to kind of come back and money start to flow back into the market.
Well, it's encouraging to know. I do want to get into some of the stuff that you've been working on. You made an announcement concerning signing a letter of intent with the Newly Institute, which is a Calgary-based company that offers rapid access outpatient programs for mental health to collaborate on expanding psychedelic-assisted therapy to patients. So walk me through what exactly this means, and also let's learn a little bit as to who the Newly Institute is.
Yeah, so absolutely. I'm going to start kind of back a little bit and talk about the Special Access Program, and something that obviously, there was a lot of excitement and still is kind of in the industry, because that's one of those kind of catalytic events that you see that shows just advancement. It also shows that there is more and more public adoption from the higher ups, which is incredibly important. The Special Access Program is something that's been around for a very long time. In the United States, there's an analogous program called the Early Access Program, and pretty much every jurisdiction globally has some sort of an analogous program. Canada was the first to add psychedelics, including MDMA, psilocybin, to that list. Basically, what it does is it allows treatment-resistant indications, and this can be a number of indications that qualify, but essentially individuals that have tried every known treatment modality unsuccessfully and need something that potentially could be effective, but is still in the clinical development stage. So in this case, psilocybin is not approved yet, MDMA is not approved yet, hopefully soon, but still not approved on a federal level as a drug. It's still in the clinical development program. So what it does is give patients that need that access kind of early stage. So for us, there's a number of ways to provide this treatment. We have a unique infrastructure at Mydecine, specifically in Canada, that we produce CGMP, both MDMA and psilocybin, and we can produce it at any scale. And we're also, far along in the drug development process. So we are one of the only companies, definitely in Canada, that has full FDA backup documentation, right? So a full IIT, all of our pre-IND enabling studies, we have all the non-clinical, preclinical that's needed. And obviously we're preparing for our pre-IND meeting on February 28th, and also our partner study on the NIDA grant study is submitting their IND, their final IND, with our product this week, actually. So something that's very exciting, and we'll be talking more about to the market this week. But needless to say, it's a very unique situation for us to have that supply and all the backup documentation already located in Canada, that we could provide the API at scale to practitioners, doctors, MDs, therapists, et cetera, that could benefit, or have patients that could benefit from this. Additionally, obviously, we spent a significant amount of time developing protocols, developing training manuals, working with Johns Hopkins and their team to do the same for our different initiatives. So our bench strength and our expertise around actually providing these treatments responsibly and effectively is very slim to none in this industry can match our bench strength. And then kind of last to the equation is that we also have the HD telehealth capabilities with MindLeap and the ancillary services, as well as an aggregate of a large amount of specialists that are trained in these protocols that can provide both pre and post care follow-ups for patients. So for us, our target partnership is not really psychedelic clinics, right? Because generally speaking, the way that special access programs work is you're providing care physician, or if it's a cancer clinic, for instance, and they have somebody that's on end-of-life care, et cetera, they've tried everything. They don't send them to a psychedelic clinic and say, here you go try that, right? They actually apply for the exemption for that patient to provide, to be provided whatever the special access program drug, in this case it'd be psychedelics. So that person and that individual, generally speaking, though, they're not going to have any resources in the psychedelic industry since it's such kind of a niche specialty treatment. So we provide a bolt-on package to large therapy networks. We're looking at very, very large hospital networks, et cetera. So we're going to already existing real medical infrastructure as opposed to targeting psychedelic clinics and providing them the resources that they need to be able to confidently and responsibly provide this treatment to their patients that need it. So our first kind of jump into that and partner was the Newly Clinic. The Newly Clinic, at its core, is an intensive outcare patient clinic that looks at addiction, looks at PTSD, and is really comprised of world-class physicians, scientists, and therapists that have focused on these different indications, not psychedelic related, for a very, very long time. And Rakesh Gently, our chief medical officer, advises for them and obviously has a number of connections with them. They're also rapidly expanding their footprint, right? They have their first clinic open, and they're opening, I believe, 4 over the next 12 months. So, a world-class institution that again, is not a psychedelic clinic at its core, but also does provide some ketamine clinic with ridiculous results, by the way. They've been incredibly successful. And for us, it was a great first partner for our program to co-develop protocols with them, to really kind of get our toes wet into this and start to develop a revenue model, start to develop how are we going to bring this at scale, and making sure that we are partnered with world-class institutions that we're proud of and that they're proud to partner with Mydecine as well. So I think that there's a number of other partnerships that will be coming in the coming weeks and months. And again, for us, it's target top down, look at large physician network, large therapy networks, and hospital networks, et cetera, to be able to be their trusted partner on this program.
When you talk about revenue, you'd mentioned that you find a lot of people are too hyper-focused on clinics being specifically for psychedelics. It's really not how the landscape's going to work. But in addition to that, you also touched on end-of-life care. How much of a need is that currently right now in the market as far as having other alternative solutions and medicines across, not only in Canada, but most importantly across the world?
Yeah, so I think there's a couple things here. One, psychedelic clinics are fine if they're done properly. But for us, I think that what we see as success is when the general medical community adopts these treatments. And a number of different things need to happen for that to be viable. One is that you need to have a second generation of drug, right? The first generation of drug, there's a number of problems with that to be able to be compatible with already existing infrastructure, half-life time, the resources that are needed, et cetera. So that's going to take a lot, a longer period of time to be able to develop those second generations of drugs. But also, for us, it's generally speaking, when you look at clinics that are also as kind of a secondary or third, part of their business, supplying psychedelics, their infrastructure is much stronger, and also their human capital is much stronger. And this is a general statement. This isn't for all psychedelic clinics, because there are some psychedelic clinics that have world-class people working for them, and I'm not taking away from that. But generally speaking, you still have this kind of slower transition of really world-class providers moving into the psychedelics. It's going to be a slow, gradual transition. So we want to work with the clinics that are not just psychedelic clinics, if that makes sense without again, knocking on too many psychedelics.
Yeah, I think people get too hyper-focused on the industry as a whole. It's a compliment, obviously, to the biotech, because quite honestly, and I know some of the conversations I had even with Rakesh down in Florida, he was saying, we're just looking for other opportunities and solutions for a lot of other, like, war veterans and stuff like that. And, it's not going to be a standalone industry. I think it's obviously going to complement just, another alternative medicine to help people that are suffering from all these illnesses, which obviously people need right now, right?
Yeah, no, you're absolutely correct. And kind of to further that, right, it's like you want to make sure that these individuals have access to other treatments, because while these are showing incredible efficacy rates, well, a couple of things. One, we're still years away from the vast majority of psychedelic treatments being available, right? So I don't want to say jumping the gun, but it's going to be a slow rollout, right? You can provide ketamine, and that's fine. But really, when you look at a psychedelic clinic, you're years away from their kind of full potential. And by that, a lot of things can change. And there'll be educational programs, and there'll be a lot of other clinics that, again, are starting to adopt this, that already have really strong infrastructure, have big balance sheets, have big, capital, access to capital, et cetera, that can add this as an additional treatment, as opposed to just something that's only focused on that. So if I was a clinic owner, which obviously we're not, I would make sure that I was a diversified clinic, as opposed to just a psychedelic clinic. I think it kind of pigeonholes you. And it also, to get somebody that, which is the vast majority of the population that could benefit from these treatments, they're still nervous about them, right? They're not fully confident in what they are. They still have that recreational context, that kind of magic mushroom context, the ecstasy, acid, these negative connotations that have been around these substances. So the way that they're going to feel confident is when somebody that's a trusted care provider for them, that they have a relationship with, is recommending that they get this treatment, as opposed to having to go to a specialized clinic that's, a psychedelic clinic and that's focused on that, right? That's a very niche business, and you're already dealing with, niche indications in many ways. So you need to make sure that it's opened up and that it's accessible to all, and that there's a confidence around that. And the way to do that is to have their already existing care providers recommend the treatment or prescribe the treatment.
In due time, what do you think it's going to take to get people to trust psychedelics as an alternative medicine? What's your thoughts on that? Again,
I think that's when the general medical community adopts it. That's when that's going to happen. So that takes an educational curve, a large educational curve. Data needs to come out. That needs to be portrayed in the right way and displayed in the right way and conveyed in the right way to that general medical community. Because again, when you go into your regular physician, your family doctor, or your therapist that you see on a weekly basis or a bi-weekly, whatever it might be, right? You trust that person, right?
Right.
And if you trust that person with your medical needs, and if they tell you to take this prescription, you go get it filled. You don't question them, right? You don't say, oh, well, what is it? How's it? You take it because that's what they're recommending. When that person tells you to go get a psychedelic, and hopefully they don't say, go have this psychedelic treatment, that term probably needs to be removed from the equation as well. But when they tell you to get this new effective treatment modality that's kind of a little bit different, but it's very effective and very safe, that's going to give you confidence to actually go get this treatment, right? So it needs to not be this kind of one-off, psychedelic treatments. It needs to be a part of the actual conversation, right? It needs to be a part of the normal medical conversation. Yep. And that is a curve and something that's going to take a long time and a lot of money and a lot of consistent messaging. But it's definitely going to happen, and it's definitely possible as long as we have, again, the industry all needs to tell that consistent message. And you can't have this fragmented messaging where some people want recreational use, some people want this, some people want that. It needs to be consistent if they really want to have this as an adopted and largely accepted treatment.
That was a big announcement, wasn't it? Health Canada with the amendment, don't you think?
Yeah, huge. Absolutely. I mean, it's a step in the right direction for sure. And it's something that, we're definitely going to responsibly take advantage of to the best of our ability, while maintaining the focus on our core business, right? This is great that we can bring this to patients.
What will your program entail, Josh, and what kinds of protocols will be included in it?
Yeah, again, we look to offer an A to Z bolt-on package that can be provided to care providers that traditionally would not be providing psychedelic treatment. And that would include the providing the APIs, the active pharmaceutical ingredient at scale. That's our MYCO 001, and then also CGMP psilocybe, our MDMA as well. And then also, again, give them the resources and give them access to our medical board and our scientific and medical advisory board to access our protocols, access our training manuals, access the confidence and also advisory services to make sure that they're trained and they know what to do in these different sessions. And then lastly, to give them access to our MindLeap platform, so they have the resources for their patients to access help after they leave those clinics in their home, and they can access professionals and also the ancillary services that are offered in that. So it's an all-inclusive A to Z package that can literally be bolted on to any clinic, as opposed to just having one or two retail clinics that they can go to.
Good to know. Last thing I wanted to ask, there's a conversation going on Reddit involving your phase 2/3 smoking cessation study. Your study and the NIDA grant-funded smoking cessation study are set to launch this year. So for the benefit of new investors, what are the difference between the two?
Sure. So both are for smoking cessation. Both are run by Matt Johnson, and both are using our MYCO 001 as the drug. The difference is the NIDA grant-funded study is an academically led study. So it's for the betterment of the science. It cannot be commercialized, and it's funded by the federal government. $4 million they provided. And that was based off an application that Matt Johnson submitted over a year ago, basically presenting all of the data from the initial pilot study that was 15 people, and also some of the interim results that he largely talked about at Wonderland and has been talking about since then, showing about 59% abstinence on a single macrodose of psilocybin at 12 months, right? So these are bar none the best efficacy rates of any known treatment for smoking cessation by far. You're talking 2-3x, anything that's even close. So that study is a multi-site study. Johns Hopkins is the flagship. NYU and University of Alabama, Birmingham are sub-sites. And it's a multi-dose study. So it's looking at 2 different doses of psilocybin, again, our MYCO 001 product. And the protocols, as far as the cognitive behavioral therapy, are pretty much identical between ours and theirs. But again, theirs is an academically run study, can't be commercialized, but will provide significant safety and efficacy data for our MYCO 001 that'll be used as further support for our study. So the difference between an academically led study as well and an industry-sponsored study, industry-sponsored requires much more documentation, much more planning. The FDA has a much more, it's a longer process. Your packet needs to be much more in-depth. Your preclinical, et cetera, needs to be, it's a much more robust package, as well as kind of the reporting as well. So you need a commercial CRO, you need a commercial IRB, ethics board, et cetera, to run all these things, the way that you store data, et cetera. So there's a ton of extra steps that go in an industry-sponsored. But again, those are pivotal studies that can be commercialized. So our phase 2/3, so real quick on the NIDA grant study, that IND, the final IND, is being filed this week. So that's huge, right? The next step, that the FDA has 30 days to comment on it. So either green light the study and or put it on a clinical hold. We're hoping that the study gets green lighted. And then they'll start recruitment and moving into the starting of the study very, very rapidly. So that's obviously incredibly exciting. Our study, the phase 2/3, we have our pre-IND meeting coming up on the 28th. Our briefing package actually gets submitted this week as well. So that is something that is a milestone for us and that we're very excited about. That study is a single dose study, so it's a shorter study, requires less resources. We think that the single dose, based off of the efficacy rates at 59%, shows enough improvement, 2, 3, 4x improvement over what's currently available. So we don't think that we need to go to multiple doses. It adds expense, it adds cost, it makes insurance reimbursement harder, et cetera. And it also adds complexities to the FDA process. So we think that the study design is incredibly unique It's incredibly efficient with the 2-3, and we believe that we'll be very successful on that study. So our pre-IND meeting is on the 28th. We believe that we should have a very positive feedback in that meeting. Our package is complete, so if we do have positive feedback, we'll be submitting the IND within 30 days of that meeting, and then moving rapidly into starting that study. So they're right around the corner, and both, again, will be running concurrently. Supportive studies. The other benefit as well that investors can look out for. There's a couple of things. We'll be filing for breakthrough therapy status upon our IND submission as well. So that's right around the corner. We believe that we have a very high likelihood to receive that breakthrough therapy status. But also in industry-sponsored studies, you don't do interim readouts, right? You read out after the study's done. It's run by a third-party CRO, et cetera. On the academically led study, they'll read out throughout the whole process. So you'll start to see insights into the effectiveness of our MYCO-001 on that NIDA grant study throughout the process, as opposed to having to wait for our study to complete. So they'll have kind of good indications that they wouldn't traditionally have had throughout the whole process, which I think is very beneficial for our investors, and also the study to keep people apprised, keep people excited, and give them kind of insights that they wouldn't traditionally have into the sites.
Still so much progress that's being made. That's why I believe, to your point, that we are going to see this turn, hopefully by the end, like you said, or sooner, by the end of Q1. But everybody I talk to, everybody in this industry is so excited about what's happening. And if people like Health Canada are coming in and making amendments, it's like this is big. And people just have to understand and be realistic about expectations as to how this rollout's going to happen. To your point in this interview, this will take some time, but it's encouraging everywhere you look at in every facet, don't you think?
Absolutely, 100%. Again, it's been a rocky road, and that's fine. You know what I mean? I think that you need to button up the hatches, you need to stay focused, and you need to get to where you're going. We're focused now more than ever. We're operating lean, we're operating efficiently, and something that, obviously we think that 2022 is going to be a monumental year for the entire industry. So
it's good.
Yeah.
Appreciate the update. Go enjoy that sun. Keep working hard. But it's always great to catch up, and hopefully I see you guys soon again. It's enough of this winter weather where I'm at.
Yeah,
get some sun.
Come down and visit, and glad that you're feeling better, and look forward to chatting with you in the near term.
All right. Thanks, Joss. Appreciate your time.
See ya.
Okay, bye-bye.